So for those of you that are joining us online and watching this video who are not here today, you missed out on an amazing conversation. So come join us. Fantastic topics that you don't get to see if you don't come show up in person. Today we're talking about benefits, how to create that benefits package to attract and retain your employees, as well as specifically some conversation around Insure Oklahoma, a program that people may have known about in the past. I actually thought it had ended. It is still alive and well, and it's amazing. So if you are either struggling to provide any kind of health insurance for employees or looking to do that, you guys chose a great day to be here. Regina Carlson is going to come to speak. She is with the Oklahoma Healthcare Authority for Insure Oklahoma. And like I said, I'm going to let you introduce yourself. I apologize. Let's get in for Regina.
My name is Regina Carlson. I'm with the Oklahoma Healthcare Authority. I have been with the Insure Oklahoma program for a total of 8 years. 4 of those were with a contractor, and then I moved over to the Healthcare Authority. Like he said, the Insure Oklahoma program is a great program. A lot of people are a little confused with the expansion of Medicaid and how that affected it and different things. So we're going to go over all of that. But I did just want to introduce myself first and say I'm so glad that you guys are here, and I'm glad to be here in person talking to people. So first I'm going to give you a little disclaimer that any policy can change at any time for Insure Oklahoma. Current policy is always at our website, insureoklahoma.org, so you can always go there for reference if you need to. And the information that I'm going to talk about today is current as of today's date. So for a little bit of an agenda, we're going to talk about the background of Insure Oklahoma, how it came to be, what its purpose was, how it works, how an employer qualifies, how an employee qualifies, college students, and employee enrollment, renewals, and then we'll have questions and answers. So first, let's talk a little bit about the background. So in April of 2004, there was a Senate bill. It was Senate Bill 1546 that authorized the funding for a program to assist those that couldn't get insurance. And in November, the initiative was created that actually provided the funding mechanism. And then Oklahoma voters passed State Question 713 that increased sales tax on tobacco. And that was the funding mechanism for Insure Oklahoma. Insure Oklahoma is funded by the tobacco taxes. It's not funded by any of the other programs are related to the tobacco. It's just the taxes. So what is Insure Oklahoma? It is an innovative program that's designed to help those that have problems getting insurance, whether it's because there's a gap in income, small businesses, they can't afford the policies sometimes, their employees can't afford to contribute to the policies. So it's designed to help those obtain the insurance that they need. And it is very innovative. We actually are the only state that has the program the way that we do it. There are other states that have tried to emulate it, and they've come close, but ours still right now is kind of a one-of-a-kind program. With the employer-sponsored program, we call it ESI. The way it works is that we provide a subsidy to the employer for those employees that qualify income-wise. So the employer applies, we provide at least 60% of the premium is paid by Insure Oklahoma for that employee. The employer, we calculate them to contribute 25% of the premium, and then the employee can pay up to 15% of the premium. That's going to be also dependent upon their income, because we do have a cap. So if 3% of their household income is less than 15% of their premium, we're going to make up that difference for them. So let's say they can only 3% of their household income is 10% of the premium, then they're going to pay 10% and we're going to pay 65%. So we've bridged that gap. So who are the uninsured or underinsured? Our target audience is going to be the small business owners and their employees. And that's going to be the individuals that just can't afford the premiums because they're just too high. We're going to talk about how it works. So there are three components to the program. There's the qualified employer, the qualified employee, and the qualified insurance plan. We call it the QBP, or qualified benefit plan. So those three pieces, once we have those three pieces in place, the employer can be approved and we can move forward with the program. And the way the contributions work, like I kind of explained a little bit, was that the employee pays up to 15% of the premium. They don't have to though. We do have some employers who pay all of whatever we don't subsidize. So they don't have to pay that 15%, but they can pay up to 15% if that's what the employer wants them to do. The employer pays at least 25%, and then we pay at least 60%. So again, if their income caps them out so that they're not paying 15%, and we calculate that premium, that subsidy, based on their income and the premium amount. So even if the employer is going to pay everything that we're not subsidizing, we're still going to calculate it the same way. So we're going to calculate it that the employee is going to pay 15% or 3% of their household income, and that we're going to pay 60%. And then once we decide what that subsidy is based on their income and everything, we subsidize that at least 60%. The employer pays the insurance, and that it's developed to be a reimbursement. Some employers do wait till they get the subsidy to pay their premium. You know, that's totally up to them and how they do their accounting and everything. But so we pay them at least the 60%, and then they either cover or have the employee chip in up to that 15% number for the premium. Now, if they have a dependent on their policy, so let's say they have their spouse, we're going to pay at least 85% of that spouse premium. And we're not going to require the employer to contribute anything towards that spouse premium. So the employee is going to pay up to 15% of that spouse premium. It could be less, it could be nothing. So let's say 3% of their household income capped out at 10% of their own premium. We're paying 65% of their premium, and we're paying 100% of the spouse premium. So, and any other dependent, if they have a qualified college student on the account, which we'll talk about qualified college students in a little bit. If they have a dependent, a minor that didn't qualify for student care because they were a little bit over the student care guideline, then we're going to pay at least 85% of that dependent's premium as well. And usually if there's more than just one dependent, we're usually paying 100% of pretty much everybody else. So for an employer to qualify, they do have to be located in the state of Oklahoma. They do have to have 250 or fewer employees at this time if they're for-profit. If they're not for-profit, they can have up to 500 employees. They do have to either apply for a qualified benefit plan or already have one in place. And they have to be willing to pay 25% of the employee-only premium. If they meet all that criteria, then they can apply for Insure Oklahoma and get approved. And some of you are asking probably, what is a qualified benefit plan? We keep talking about this, what is it? So we do have several carriers that are contracted with Insure Oklahoma. We've got the big guys. We've got Blue Cross Blue Shield, we've got Aetna, we've got United, Community Care, and there are some others that are qualified. That list is on the Insure Oklahoma website, but so it does have to be one of those carriers. And then they have certain plans. It has to meet certain criteria. It has to cover hospital, lab, physicians, x-rays, pharmacy, all of those services. It has to have no more than a $3,000 out of pocket. The maximum office visit copay is $50. If the pharmacy has a separate deductible, so if they have a deductible for the plan and then they have a separate pharmacy deductible, that deductible can be no more than $500, and it must be through a contracted carrier. So if you go to our website and you click on a carrier, say Blue Cross Blue Shield, it's going to bring up a list of all of their plans that are qualified with us. And so it has to be one of those plans. If you have a plan that meets that criteria and you don't see it on the list, you can contact your carrier And if they look at it and say, oh yeah, that should be a qualified plan, they can submit it to us and we can review it for approval. But it does have to meet that criteria. A lot of plans with Blue Cross Blue Shield, it's mostly the platinum plans, I believe, that qualify. But all of the carriers that are up there do have quite a few plans to choose from. And if you contact the carrier directly and tell them you're looking at Insure Oklahoma, or even a broker, and tell them you're looking at Insure Oklahoma and you want to make sure you're on one of the plans that qualifies, they'll be more than happy to help you with that and to tell you whether it qualifies, because they're very familiar with it. So again, there's a list of carriers in the presentation. I did send a copy of the presentation to Jill, so she can forward it to you guys later for reference if you want it. And there is a list of contracted carriers in the presentation. There's also a list on the website. And like I said, if you click on the carrier on the website, it will take you to the plans that are qualified plans. So once you have all that in place, or you're applying for it, or you've pretty much decided what you're gonna do, how do you apply? So as an employer, you're gonna go online to insureoklahoma.org, and you're gonna go ahead and apply online. It's gonna have you enter your federal employer identification number. It's gonna have you enter the demographic information for the business, the main contact, your staff listing, your EFT information, because the way that we give you your subsidy is we automatically deposit it into your bank account. You're going to have to submit the rate sheet and summary of benefits and coverages for the plan that you're on or going to be on. Once you've done all that, then we review it on our end. We have up to 30 days to process an application once it's been submitted to us. If that 30 days, usually it's a lot faster than the 30 days, but we do have up to 30 days, and that's to give us some time to go back and forth if we're missing something or we need clarification on anything. You do have to be current with your Oklahoma Employment Security Commission taxes. If you're a nonprofit and you don't file that, you can send in a payroll report for the last quarter. Or if you're with a PEO, we have to make sure that it's a qualified PEO with the OID, and then you can send in a payroll report for that as well. So once you're approved as an employer, how do the employees get approved? So for employees, they have to be between the ages of 19 and 64. They have to meet our income guidelines. They have to be employed with an approved employer. And they have to be able to work the eligible hours. They have to work the eligible hours that the employer sets. So when the employer applies, they tell us how many hours an employee has to work to qualify for their benefit plan. They usually use that same number to qualify for Insure Oklahoma as well, because if they're not on the benefit plan, there's no point in being on Insure Oklahoma. So they have to work the number of hours that the employer sets. So make sure if you're an employer applying that you put the number of hours that you truly do require the employee to work to qualify for the plan. Because if you put 40 on your employer application with us, that's what's going to go in our system. And then if an employee works 38, but they really do qualify for your benefit plan because you only require 30, they're going to get denied for Insure Oklahoma because they don't work enough hours. So, and then they cannot be on Medicaid or Medicare. If they have a spouse pretty much qualifies the same way. They have to be between the ages of 19 and 64. They have to live in Oklahoma. If they are employed, they have to be employed with an employer that would meet our criteria but is not approved for Insure Oklahoma. So if they're employed, they can work for, the restaurant down the street, and that restaurant doesn't participate with Insure Oklahoma, so they can be on your plan. If they work part-time, so if they work 30 hours or less than 30 hours, they can work for a large employer like Walmart or Lowe's or whatever. But that has to be 29 hours or less.
Is there a minimum hour for the qualified employee?
For the employee, it would be whatever the hours are that the employer put on the employer.
So even if it was 5 hours that the employer designated, that would be fine. There's no point.
For children, if they're minors between the ages of 0 and 18, they cannot be on Sooner Care. They cannot qualify for Sooner Care. So when the employee applies for Insure Oklahoma, if their kid is already on Sooner Care, then the child is going to stay on Sooner Care, because if they qualify for Sooner Care, we cannot due to funding and everything, we cannot subsidize for that child. If, however, there is a little bit of a gap between the Sooner Care income guidelines and the Insure Oklahoma guidelines, ours are just a little bit higher. Sooner Care cuts off at, I believe it's 185% of federal poverty level, and we go up to 227%. So if they're in that gap and that child doesn't qualify for Sooner Care anymore because they're over income for Sooner Care, then they can put that child on their Insure Oklahoma as well.
Does the Insure Oklahoma for children qualify for like the college students and like at the age, what, 26 or?
We're going to talk about college students in just a second.
So if they're not in college though, could they qualify if they're in that age bracket?
Unfortunately, if they're not in college, they wouldn't qualify for ESI. However, that child, that college age child could qualify for the Sooner Care Healthy Adult Program. So that would be an option for them. For the ESI guidelines, just a little bit of an example. Also, the adult cannot, with the expansion of Medicaid, it did change our program a little bit. It used to be that we didn't have a minimum income amount for you to qualify. You just had to be under the maximum. With the adult expansion for Medicaid, which was passed by State Question 802 last summer, and it went into effect July 1st of this year, and it's the Healthy Adult Program. You're going to hear a lot of that in reference when people are talking about Medicaid and Insure Oklahoma. With that, that did make us have to create a minimum. So if the adult qualifies for the Healthy Adult Program, if they're low enough income that they do qualify for that program, then they have to go on Sooner Care or be on their employer's insurance without subsidy. Insure Oklahoma cannot, just like with children, Insure Oklahoma can't subsidize for the adults that qualify for Sooner Care. So, for an example, if you have a family of 4, the minimum income to qualify for Insure Oklahoma is going to be $3,050 a month. The maximum is going to be $5,015, and that's household income. So if the spouse works too, it's going to be combined. Or if, let's say they have a college student and the college student's working part-time, it's going to be combined income. So they do have to be in that range to qualify. For a single person, the minimum is $1,484 and the maximum is $2,438. So that's just kind of an example of how that works out. Now, for the college students, they have to be between the ages of 19 and 22. Insure Oklahoma only goes up to 22 at this time. They have to attend an accredited Oklahoma college full-time. So it does have to be, they can't go out of state to college to qualify. And they're gonna have to supply us their current FAFSA, which at this time is the 2021-2022 school year, and their current class schedule. So it would be the fall of 2021 at this time. And then all household income is gonna count towards them. And they would qualify as a dependent of the parent as long as they're in that age bracket and they are attending an accredited Oklahoma college.
What if the parents live out of state?
If the parents live out of state, then they wouldn't qualify for Insure Oklahoma, so the college student would not. That would be a situation where the college student may want to apply for, if they're living in Oklahoma, going to school, then they may want to try the Healthy Adult Program as a household of 1. So just like other dependents, if the college student does qualify, they do have to be dependent on the FAFSA. So they would be dependent of their parents. And as long as they're a dependent of their parents and they qualify as the qualified college student, then we're going to pay at least 85% of their premium, just like any other dependent.
On that maximum annual income, that's combined, if it's 2, family size is 2, that's combined income?
Correct.
Regina?
Yes.
My brain can't let go of the fact that it seems like 18-year-olds that live on their own, just they're not qualified to get anything.
Now, if they're 18 and they're low enough income, they would want to apply for the Healthy Adult Program. Well, actually, no, they would still be a Sooner Care. They would still be under the Children's Sooner Care technically, even though they're on their own, and even though they're 18, Sooner Care actually goes up to 19. So for their 18th year, they would be on Sooner Care, and then once they turn 19, they would either apply for ESI or the Healthy Adult Program, whichever they qualify for.
On the maximum,
Uh-huh.
you say if the college student goes, it works part-time, that's included in the dollar amount?
Yes. Now, if the college student isn't applying for ESI and they're independent, then they would be their own household. But if they're dependent of their parents and the parents claim them on their taxes, then yeah, it would be by now. So for an employee to enroll, once the employer is approved, there's going to be a number generated called an EEN, Employee Enrollment Number. The employer can get that from their portal. They'll give that to the employee. The employee will log on to our website, to our member portal. If they have kids on Sooner Care, they already have a login. It's the same portal as the Sooner Care portal. If they don't have kids on Sooner Care and they've never applied for Sooner Care, then they would create a new account. They would go into the application, add that EEN, mark Insure Oklahoma as the program that they're applying for, add the EEN on the employment section, and then submit the application. It's that simple. And if they do have kids and they want to see if they're going to qualify for Sooner Care or if they're going to have to put them on their insurance, they can do that all in one application. Because they're going to add all the household members, they're going to mark, they can mark Sooner Care and Insure Oklahoma for everybody in the household. That way, at the end of the application, it's going to put them on whichever program they qualify for. And again, they do have to have all household income when they're filling out the application. Employer renewals happen automatically every 12 months. There's nothing the employer has to do. The only time the employer has to do anything for that is if we send you a letter saying, hey, we're having trouble verifying OESC, we need you to send us this. Or we need, something else. But that happens rarely. So usually it's a pretty seamless renewal process. If they're changing, every time your insurance renews, you're going to want to send in new rates in SBC. If you're changing plans at that renewal, because let's say the plan you are on is no longer a qualified plan because they upped the deductible on it and it's too expensive, so now you want to jump down to one that still is an Insure Oklahoma qualified plan, you just send us you do have to print out the 2-page application and fill it out so that we have authorization to change the plan. And then submit it with the new rates in SBC. Employee renewals, they technically happen every 11 months because Sooner Care is a time-sensitive program, whereas Insure Oklahoma, we start at the first of the month every month. So if if an employee is approved for Insure Oklahoma now, they're going to be effective September 1st. Whereas if they qualified for Sooner Care and they applied today, they would be effective today. So the way our system works for Insure Oklahoma is that basically the employee renewal is every 11 months. So they're going to be approved for September 1, and then they're going to have to renew again next July. So, and they just log into their account, make sure all the information is correct on the application, and resubmit it. It's that simple. Or they can call the helpline and do it over the phone, whatever they prefer. We do send out documentation requests every once in a while. Especially with employees, because we cross-reference with the Oklahoma Employment Security Commission. So sometimes income, varies, and so we have to get some documentation. There's 3 ways to submit it. They can upload it to their member portal, they can fax it into us, they can email it to us. Employers can submit documentation the same way. Upload to your employer portal, fax it to us, or email it to us. And it takes about 21 days to get documentation processed. Usually less than that, but we have 21 days. And that is pretty much it. Does anybody have any questions now? Are there any other questions?
Yeah, just look at the income requirements. I know a lot of times it's kind of right at the cusp of
Right.
what do we do? Is there anything, if they go above that maximum, is there a tier or any other programs, or is it basically you got to figure out, do we give you a raise or do we keep you where we are so we can afford your insurance?
Unfortunately, there is nothing after Insure Oklahoma. So if they do go over income for Insure Oklahoma, then that's going to have to be worked out between the employer and the employee. Healthcare.gov. There are some, like you said, that are right on the cusp, and so a little bit of overtime or a bonus or anything kicks them over. and that happens. What happens is the system will pick up on that. They're supposed to report it within 10 days if they get a bonus or get a raise. OESC also does a cross-reference every quarter. And so if, let's say one quarter they worked a little bit of overtime and they didn't go in and change their application because they thought, it's only a couple hours, I don't need to worry about it. OESC cross-reference came through and it showed that they were a little over. It's gonna kick out a documentation request. They're gonna have to send in 30 days worth of pay stubs. If on their most recent 30 days worth of pay stubs, they still qualify, then they're good. If within the most recent 30 days they're over, then it's gonna kick them off. But then if the next month they don't work any overtime, they can resubmit 30 days worth of pay stubs to be recalculated again and go back on. So they can't, those people that are on the cusp, it's tough because they can go off in one, and the cusp the other way too, because they can get kicked to sooner care and then off of sooner care. So it's tough when you're in that, either of those lines. But, we try to make it as helpful as we can, and we don't just like kick them off the second the system detects something, to give them that opportunity to work it out.
The employer is the one that receives the subsidy.
Yes.
And so they've got an employee that's in the system. Now, they know that employee's wages qualify for this, but the employee has some type of outside income that's coming to them, which kicked them out, put them over. But the employer was the one that got that subsidy.
Right.
Is the employer then required to pay back, or is there
No.
a clawback?
No, we don't. Now, in the event that there was something fraudulent going on, there would be. But if it's just a simple, the employer didn't know about that extra income, they got everything set up, or something happened, maybe even that income wasn't.
That might not come to your attention until after into the next year. That's
Exactly.
they filed their taxes and you now are.
Right. So we don't do retro. Like if we kick somebody off because they went over income, we don't do it retro. We do it, so like if we recognize this month that they're over income, we're gonna kick them off at the end of this month. So they're gonna have this month, and then after that you're good. So the employer's not gonna have to worry about having to pay back anything. The only time that happens is if we overpay on somebody because, let's say, like a lot of times on insurance, they won't pull the person off right away, or the employer doesn't report it to the insurance right away or whatever. So there's a couple months that they're on the invoice that they're really not covered by the insurance. And so we're paying out because we're seeing them on the invoice. And then we get an invoice that says, oh no, they were actually terminated 3 months ago. Then in that case, we will recoup the overpayment. But in the event where somebody was terminated because they went over income, that doesn't happen retro. It goes forward.
Thank you.
All right. Thank you.
We're going to go and move on to Matt Tipton with YHR. And Matt's going to give us a little more of a broad overview on benefits and crafting it. And I'll let you go.
Just let me talk.
Yeah.
From an HR side of things, I represent businesses to help put these plans together, and they get somebody that comes in and actually will sell you the policy, broker the policy, all that good stuff. So I work on the strategic side with businesses to make sure they have good benefits in place from a total concept, from a total comp concept. Few things with Insure Oklahoma that I want to debunk right quick, because maybe you work with a broker right now, if they've ever told you that, oh, don't mess with that. You already have an insurance plan. You can have more than one plan, okay? They are lying to you for a couple of reasons. One, they're either insecure and they don't understand it. I'm just gonna call it like it is. Or two, they don't want to do the paperwork, okay? So every business that I work with, I talk about Insure Oklahoma, and it's important we're working with somebody that understands it and will take the time to sit with your employees, go through that application process, get you set up with your employee identification number and everything in that system. These plans, if you looked at the you know, the deductible and everything that it meets for Insure Oklahoma. If you're curious what that is from just a layman's terms, that represents a gold level plan. So, you know, you have bronze, silver, gold, and platinum. Essentially, this is good insurance. It's really good insurance. It's gold level for somebody that only has to contribute 15%. If you think, yes.
So I was kind of what you were saying about the employer can have more than one plan. Because that's what I was wondering if that was one of the objections that you get a lot is an employer says, well, we have, I don't know, health choice or something, and our employees really like that, and most of them can afford it, so we don't want to mess with switching to something else.
Yep.
You can have, an employer can have 2 plans.
Absolutely.
One, and then this one for people who want to go the.
You bet. You can have 5 employees and have 5 plans if you really want to spend the time putting it together.
Okay.
I would never recommend that, but certainly from a strategic standpoint, you want to offer a gold standard plan that ties into Insure Oklahoma. Okay, and then in addition to that, there are other ways to construct benefits. A gold level plan for a lot of employees, especially younger and healthier employees, is you are over-insuring that employee. And I talk about over-insuring employees quite a bit. And what does that mean? It's like, oh, well, I want to offer insurance. Well, you're paying for something that they're not using. Okay? It's cool and it's flashy and it's out there. You can put it in a job posting and it catches their eye. But the reality is, it's a benefit in name only, is a good way to put that. And we really want to think more about what can we offer within our business that satisfies the whole. And so Insure Oklahoma is one of those pieces. It's a great piece. There are some companies, due to salaries and wages, if I'm working in tech companies, probably nobody's going to qualify. But right here in this restaurant, absolutely. When we look at those salaries, maximum annual income at $29,256 for one employee, that's somebody that's making less than $15 an hour, working 40 hours a week. Just as a quick news flash for those that work in the industry, they're essentially working 5-hour shifts. If they work 6 days a week, they're only working 30 hours. Okay, that's what you're looking at, because that's how they maximize income while they're here. So this plan can really adapt, based on how your business is set up, to really help out a lot of families. Now, aside from that, I told you I look at benefits from a total comp standpoint. There's a few things that you need to know. We started out this conversation earlier talking about child care benefits. That's a huge deal. That is one of the big factors to retaining talent right now. We have a big issue with how we've, especially when we talk about maternity leave and paternity leave and what that looks like in small businesses, we kind of are left, we feel handcuffed in that area, like we can't provide those things, and that's really not true either. There are opportunities in short-term disability that we can look at that's at a minimum cost to employers that I encourage you to do, that pay somebody 60% of their salary for 6 weeks. And that's strategic. And then you think about what, other income from an employer side of things that you can't contribute. One of the biggest things I hear from employers, and I get it, benefits are expensive. So is turnover. We can right now, this is not me talking, this is statistic history that's talking, that for a lot of positions, 1.5 times annual salary is the cost of turnover on a position. I guarantee you 1.5 times annual salary is a lot more than 12 weeks off for, if it's surgery, cancer, all right, having a kid. Yeah, absolutely, if we really want to do the math. And that's the kind of stuff that when you think about retaining employees and the retention benefit, because of efficiencies and everything that goes like this on our, efficiencies go up, bottom line goes up, all those things that happen, that's a disruption if we don't take the time to really look at what our employees want. And that's the other thing that I want to transition to, is a lot of time with employers we forget to ask. We think we have these really great ideas and benefits, but we never really ask our employees what we're not offering that they'd like to have. You throw out health insurance, 401k, child care subsidy. I mean, you put it all out there, and you'd be surprised with the information that you get back, that maybe all 3 are great, but maybe one is more of a priority to your employees today than the other 2, and maybe let's focus and start there. A lot of times we want to rush to insurance when we think of insurance, health insurance, when the reality is they're getting it somewhere else. So don't mess it up. And let's focus on what can we do from a profit sharing standpoint, an IRA or a 401k, and we may want to look at that and start building wealth in these employees. That also creates retention benefits in each of those areas. These are each of those components. One of the things that we learned during COVID, let's take some lessons from the pandemic. What we learned is that it's not all about salary. Newsflash, you will always lose on salary. Somebody will always pay more. If it's 50 cents or $5 or $5,000 annual, somebody is always going to pay more. We have to quit baking the cake. Anytime you give somebody a raise, you're baking the cake. You can't take that away. All right? And one of the lessons that we learned during the pandemic is we found that employees don't go back to employers where there's insecurity. When you mess with salary, you create insecurity. That means employees start looking elsewhere. A lot of people wonder why a lot of people aren't coming back to, restaurants. Same reason they're not going back to oil and gas. When the hand bites you, why are you going to run back? You're looking elsewhere for where that security and income is going to come from to pay those bills that aren't going to stop coming in the door. And so we want to think in the total comp standpoint, from a total comp perspective, that it's not all about the salary. What we're seeing now with employers is they realize that, because as soon as they cut everybody's salary, by 20 or 30% to keep them on board so they can make bills from a company standpoint, it created that doubt. People found jobs elsewhere, they left, they resigned, they went other places. So what do? Well, one of the things that we try to instill in business owners is let's talk profits. Let's talk about how we can build an incentive-based program from your highest paid position to your lowest paid position, that whole tier where everybody is bought in to the bottom line and it comes back, and not necessarily get caught in this wave if we need to give somebody a 5 to 10% raise every year. Because again, you're going to lose every time if that's your only strategy. It's just facts. And so what we're seeing again, COVID, lessons learned, is let's really start changing the way we think about how we do bake that cake and what we can do differently from a total comp, and where can we offer different kinds of benefits and what that looks like. Any questions on any of that? I love this topic, so I can kind of come at this a few different ways. But
what are some unusual benefits that you've seen out there that have really been popular?
Well, let's talk about health in general. Who wants to go sit with a lot of people that have COVID in the urgent care? Nobody? No? Okay. Or those types of practices. So let's talk about, there's insurance. So one of the things that's really spun up, this actually isn't due to COVID, but became more popular during COVID, that's outside of insurance, is instead of health insurance is health care. And what do I mean in the difference between the two? Is that there's a wave of what's called direct primary care. I'm a big proponent of it. I work with all the DPC physicians in the state. And what is direct primary care? That's kind of like concierge medicine. So these are individuals that you're paying kind of like a gym membership to have direct access. You're like, well, is that similar to Teledoc? Well, Teledoc, you're going to talk to somebody different every time you get them on the phone. You talk about your history, your health history, all of that. This is actually your primary care physician. And these docs, their going rate's about $69 a month for adults, about $39 a month for kids. I know those numbers pretty well because, again, I'm a big proponent of it, and it's something that can work similar to, we call them bolt-on plans. So in other words, if you wanted to offer direct primary care, like that sounds awesome. Yeah, it is awesome. It's great. I have it. My wife and I have it. So we never go to an urgent care. We never go sit in a doctor's office somewhere. And if we do, it's with our DPC, and we go to their office, and we don't get rushed in and out. We're not in there with 20 people. We walk right in. It's VIP treatment. And you're like, how is that possible? And it's like, well, that's their business model. And it's one that's gaining in popularity nationwide. So this is not a flash in the pan deal. These are physicians that have kind of been fed up with the 7-minute visits inside. They all have worked at Mercy, Integris. I mean, that's where they come from. But they've started their own independent practice of offering that. And employers especially, that haven't ever offered a plan, have seen this as a huge strategy, and it's amazing care. My wife and I have good insurance. We do. But we utilize our direct primary care because that we utilize as it's tied to a healthcare savings account. We can build up, funds in that HSA, which is another great strategy. And then we have our DPC over here. And this is what we utilize for everything we need, short of having to go to the ER or a specialist for surgery, which is why you have your insurance. It's a great tie-in. And I will just tell you, there's going to, just like I'm telling you right now, that everybody needs to be offering Insure Oklahoma as an option to their employees. Obviously, you need to go through the process, make sure it makes sense. But DPC, where that may be new to you right now, or maybe you've kind of heard about it and you're kind of unsure, it's going to become the norm. This is a thing. And actually, Oklahoma has a great foundation of DPC practices that are fantastic. And I'd say we're close to leading the nation in that area, at least getting it off the ground. But it is nationwide. Yep. So good.
Other kind of beyond that.
Yeah. Beyond that, I mean, there's all different kinds of strategies. Healthcare reimbursement accounts are really big. So you set up a high deductible health plan with an HSA, or a high deductible health plan without an HSA. It's all right. But what you do is you're able to buy down on the deductible for employees. That's an option.
Beyond healthcare?
It's part of healthcare. Oh, beyond healthcare. Oh, okay. I'm sorry.
Benefits.
Yeah. So beyond healthcare, sorry. We're looking at tuition reimbursement right now is a really big deal. It's kind of funny. I wrote a blog on that. It's been almost 3 years now. A guy contacted me out of Austin, Texas, which is interesting. He goes, "Are you getting any hits on that?" And I said, "You'd be surprised. More and more businesses are looking into that because so many students are coming out, coming out of college, and their debt is so big that what happens is they get hired, and if you're an employer, you own a business, you've probably heard this, you hire somebody, they say yes, and 6 months into it, they're already asking for a raise. Why is that? Because 6 months later, the government can call and said, hey, now right now, a lot of that's been deferred. But tuition reimbursement is big because what happens as soon as that stress hits, what happens in stress is that we look for an outlet. And just kind of similar to what we've been talking about this entire time, if you can be that outlet and provide that stability to that individual and understand what they're going through, and that's what makes the most sense for them, especially if that's the industry that you're in, that you're hiring out of universities, then you need to know that that is going to be an issue. And it's amazing to me how many times employers say, I can't believe this person's already asking for a raise. And it happens all the time. It's like 6 months. When did we hire him? 6 months ago. Yep, got it. That's why. So let's put a strategy in place for that. Let's talk about this beforehand. Let's have something there, because the reality is we all live paycheck to paycheck, and most of us live outside of our means, and I'm guilty, we're all there. We just can't ignore that fact and say, well, you should have been better. Well, okay. What does that get us? We need to be, from an employer standpoint, and then again, I can't stress childcare enough. Yeah, that's huge. Absolutely. So, long-term care benefits is also huge. I think some of us are finally starting to realize how much money it takes to take care of a parent. If you can start building long-term care benefits into your employee's account now, maybe not all of them will see the benefit of that, but I have some employers that are really stressing it, that are actually in that industry, and they're pouring that into their employees, and they really understand that benefit because they're like, yeah, that's expensive. I know what we charge. That's expensive. That's really cool that you're doing that for me, because you're building up a bank to where I'm going to be taken care of and my kids aren't going to have to do it. That's huge. Long-term care, you're going to see more and more of that being offered, and people are going to understand the value of that because it's going to start at home.
Do you ever see a challenge like young employees versus older employees? Like, I can see that tuition reimbursement would be great with younger employees, and your older employees are like, that this means nothing to me, I paid my loans off 20 years ago. And
sure.
When you say to the younger ones, how about long-term care? How about 401k? How about health insurance? Like, I'm healthy, my parents are healthy, I don't care about retirement. I want lots of vacation time or work from home. And then you're trying to balance like what your older people want versus what your younger people want.
All of that. So what you just said, so the answer, I guess, do I see it? Yes, I do. And the side of the structural standpoint on that, it goes back to you need to pull your employees. You need to ask them what's important to them. So let's narrow that scope, right? And let's see what's important to your older workforce. Let's see what's important to your younger workforce, and then find that medium that applies there. Yeah, absolutely. I know that when my wife took her newer job, I guess about 3 years ago now, they were really great with their benefits because they just said, here we go, we give you this much money. So what do you want to buy with it? You kind of just go to the shopping cart, and it's really nice. We're able to really, like I said, that what was great about that is that we're able to load up our HSA through her benefits, and then I pay for a direct primary care through my business. So,
Is it, are a lot of companies going to that where you're like, this is your benefits
Yes.
allowance, and you just do what you want?
yes, yep.
How is federal employment law keeping up with these changes as far as just being dynamic and agile in our response to keeping our employees? And does that cause problems?
First part of your question, how are they doing? Not well. Second part of your question, does it cause problems? Yes. But that's where it helps for us as business owners to continue to talk, because they're always behind. So they have to know what's important to us, where the breaks need to come from for employers, from a legislative standpoint, and what they can do. I think direct primary care is a great example of that. Our legislation has been very late to the game to figure out what it is. They didn't know what it was. They're like, well, it's health insurance. Well, it's not, because it's not insurance. And they're like, well, then is it health care? Is it a gym membership? And if it is, can you pay with it? Can you use your HSA to pay for the membership? And that's what's going on right now, is you can't. So we have to pay for the membership with post-tax dollars. But if I get a prescription while I'm at the DPC, then I use my HSA. So, you know what I'm saying? So they're not there yet, but in my opinion, they should be. But that's, again, more and more legislation that's getting written. Yep.
Following up on Jill's question about some kind of out of the box stuff,
Yeah.
have you seen anything unique post-pandemic? I know you helped us develop ours a few months ago, and one thing we did was that quarterly mental health day above normal time off. What other things are you seeing?
Let's talk about two of the biggies. And I'm sorry I didn't bring this up earlier. Like I said, I can go a long time on this. Two big things that need to happen post-pandemic, if they're not happening right now, is mental health. It's a big problem. All right, it was a big problem before. We just, a lot of us kind of ignored it, or just said that's your problem, figure it out. Mental health, I can't tell you, if you don't have an employee assistance program in place for your employees, reach out to me. I can give you multiple outlets of great nonprofits that offer employee assistance programs that you should be offering your employees. It's probably the most important benefit that you can have out there right now.
We put their a chance for change.
Do they do that?
Yeah, they're a member.
Oh, very good.
A member nonprofit.
Awesome. A couple other groups that we work with. There was an individual here earlier that was actually running out to go to North Care. North Care has EAP programs for businesses, and so does Sunbeam Family Services. They do really well in that area. But again, we have to understand from a mental health standpoint that this goes back to return on investment. You're investing in your employees' mental health, that the healthier they are, the more efficient that they are, the less mistakes that they make, their headspace, and when they come to work. You're talking about safety issues. I can give you a big list. It's big. It's big. Other things that from a popular standpoint, as you mentioned, I think that's the most important, by the way, mental health. Let's really harp on that, and I cannot stress that enough. There's a spillover effect podcast that's out there. Shameful plug, I've talked on it a couple of times, it's not mine. Michael Dickerson is who puts that on, he's local, but he's been doing this for years, and it's really great. It talks about the spillover effect, and it's about how us as employers, by creating a mental healthy workplace, how that comes back to us, because what happens is, if you ever found yourself in a job where it was just really terrible, and what did you do? You left the job and you went home, and all you did is talk about, again, how bad your life is and how bad your job is, and that spills over into your family life, and that goes south, and that comes back full circle over here. A lot of times we used to say, hey, get your family life together so that you can get your head right here, and the spillover effect is actually what it has taught us, is that if we create a good headspace at work, that spills over into our personal life in a positive way, which again comes back into the workplace. And that's the role, because we used to say we're not going to play a role in that as employers. It's kind of more of an old way of thinking, is that no, we need to take an active role in that because of what it actually does mean, not just to the individual, but to the business. That's the most important. Popular, pets. I will tell you right now, yeah, absolutely. I've been writing more. I revised an entire employee handbook for a company. They fairly new, but they brought us in and say, hey, let's revise this. And I was like, I really think that with your staff, that if you put in a bereavement day for the death of a pet, that would go a long way. So we did all this. We added PTO, paid time off, all this stuff. The biggest compliment we got via email back to the owner was on the pet benefit. 100%. So adding a bereavement day for the loss of a pet. And it's a big deal. Do you think you could, I don't know how that's close to our pets, but if we lost our pet, to know that we got a paid day. We give, a lot of companies give 3 days for a family member. To give a day for a pet, that may be the closest thing to that employee. That's a big deal. There's also pet insurance that's out there that's now being written. That's a big deal that you can tap into as well. Your PNC broker that you work with can show you those options.
Is it important for employers to remind employees of the value of their benefits?
Yes.
And to be explicit about it? Look, this is what you get because you work here.
Yeah.
And that's not grandstanding on the employer?
Not at all. In fact, I'm a big fan of total comp sit downs. Like every year, multiple times a year, you should be talking about the total comp of their value in the company. So in other words, it's not again about the salary, it's a bigger part of the pie that I'm paying you this, but this is actually what you're getting and what that is. I've seen employers cancel benefits because they felt like their employees didn't understand. And the reality is that the employees probably didn't understand what they were getting, and that's unfortunate because it was a really good benefit. And that's a failure on us, that's not on them. And so yes, we should be doing more of that, 100%. Yeah. This has been great. Anything else?
I think the cops are coming for me.
I know. They found me. That's what happens every time I get on campus.
So one thing that we didn't touch on, and I'll, for transparency's sake, Matt came into my company, and that was what, 8 or 9 years ago.
Yeah.
Since he did, no one has left. I've had to terminate people with cause.
Yeah.
But no one said, I want to go get a job somewhere. And it's because of the stuff that we did.
Yeah.
One of the things that we did is we used to have 2 buckets. We had paid time off and unpaid time off.
Mm-hmm.
We've since we moved to 3 buckets.
Yep.
We have PTO, whatever, covered.
Yep.
We have covered. And for us, that means if you take a medical day, even a medical health day, I don't need a doctor's note.
Sure.
We're just going to pay for that. And then we have literally unlimited time off.
Mm-hmm.
You need to take a month off. You need to go away. As long as the company can say yes, you can take it. I think that's an acknowledgement of people that goes better than we're all just family here. Mm-hmm. Families are dysfunctional, but
yeah, I certainly, and this is where it really has to sit down and get into the business. Not every business is alike. Not every business, can operate the same way, especially from a time off perspective. But we do need to, create some outlets for our employees so they don't feel like they're being punished. Too often, taking time off, even if that's a vacation, can feel like punishment to an employee, which is why a lot of them don't want to take a vacation. And the reality is that they need to. And we want to encourage them to. So it's creating, again, from a mental health space, an environment of encouragement that they do need to take that time off, creating a policy that basically pushes them into. I met with one of my employees just the other day, and I was looking at their PTO balance. I called them in. I said, you got to take some time off. I was like, so figure it out. You're getting out of here. You're getting paid. It's all good. Do it. Because I know it needs to happen. not just for them, but for the business. It needs to happen. And so that's important. And there's a lot of structure that we can put in there. As Lawrence mentioned, multiple buckets. Certainly we want some kind of structure. If you go full on, take as much time as you need. We're not going to create any parameters around it. I will tell you, don't do that, because that creates a separate set of anxiety because everybody's kind of like, well, should I take time? It's a whole other thing. So these companies that say we have unlimited PTO, it's a lie. And employees actually, that becomes even more headspace for them. Give them a box that makes sense, policy around that box, and everybody will be in good shape. I assure you that. So, anything else? They're bringing the tickets. And has this been good? Is this kind of what we're looking for? Okay. Never hesitate to reach out to me. I mean, like I said, I've never not taken a phone call or an email, even if we're not working together, B2B. This is where we thrive and what I love to do. So be happy to visit with anybody anytime.